Terrified of dogs? It's time to turn that fear into friendship. In just 5 simple steps, you can overcome your anxiety and build a confident bond with a furry friend. Discover how to go from fear to friend and transform your relationship with dogs forever. But first, let's consider, do you have cynophobia? It's essential to recognize the difference between a fear of dogs and general nervousness or dislike. Some people get anxious around certain dogs, like large breeds, but keep their distance. However, if you have cynophobia, you have an overwhelming fear of dogs. You likely go above and beyond to avoid any encounter with a canine. Your stress levels kick into overdrive when you hear a dog bark in the distance. Or you don't go outside at certain times of the day because you know it's when your neighbor walks their dog. Maybe your heart starts racing when you walk into someone's home and spot a dog bowl. The dog isn't even around. If these scenarios sound familiar, you likely realize your heightened response to dogs is excessive. It can be challenging for people who don't have a fear of dogs to understand. However, this is often the case with many anxiety disorders. People fear typically harmless things or frequently worry about every potential what if. If you're afraid of dogs, the sheer panic you feel when you see a dog approaching could make you physically sick. What are the symptoms of cynophobia? Symptoms of cynophobia vary from person to person. What triggers your anxiety and fear can differ significantly from someone else's. For example, you start to get clammy and anxious when you see a dog. However, another person might experience severe symptoms at the mere thought of meeting a dog. The symptoms of cynophobia are similar to those of other phobias. They include increased heart rate, chest pain, headaches, dizziness, crying, screaming, shaking, nausea, vomiting, diarrhea, feeling like something terrible will happen, sweating, shortness of breath, difficulty swallowing, dry mouth. People with phobias can experience panic attacks, but you don't have to have panic attacks for a doctor to diagnose you with cynophobia. Talk to a healthcare professional if fear of dogs is consuming your life. They will ask about your symptoms, history with dogs, family history of phobias, and quality of life. Your doctor may also refer you to a mental health professional specializing in phobias. How do people develop cynophobia? According to the National Institute of Mental Health, NIMH, roughly 9.1% of the U.S. population deal with a specific phobia. Furthermore, the Anxiety and Depression Association of America, ADAA, points out that phobia symptoms typically begin in childhood, around 7 years old. Many people assume that if someone is afraid of dogs, they must have been attacked by a dog. However, this isn't the case. But how do people develop a fear of dogs? Professionals believe people can acquire cynophobia due to a mix of past events, genetics, and other factors. So, it could be you were bitten by a dog when you were a kid, or saw a dog attack someone else. Perhaps a dog chased you, and you were frightened. If your phobia results from a traumatic experience, it could begin as post-traumatic stress disorder, PTSD. Sometimes, people can develop cynophobia because they grow up with someone who fears dogs. Healthcare professionals also point to several other conditions making someone more susceptible to developing a phobia. These conditions include a history of mental illness in your family, depression, general anxiety disorder, GAD, substance abuse, or a history of panic attacks. The 5 ways. Living with cynophobia impedes your ability to live a normal life. Your phobia keeps you from doing things you want to do and going places you want to go. If you're ready to overcome your fear of dogs, you can do several things. And no, it doesn't mean you have to get a dog. Number 1. Talk to your doctor. It's important to seek professional care if you're dealing with any phobia or irrational fear. A therapist can help you understand your fear of dogs and where it comes from. Your doctor will suggest various types of therapy and possibly medication that can help you work through your cynophobia. Number 2. Understand what cognitive restructuring is. Many phobias, including cynophobia, are based on how your brain comprehends a specific situation rather than the actual situation itself. For example, you're not likely afraid of the actual dog in front of you, but rather, your brain is interpreting the dog as being a threat, which is then causing you to be fearful. Cognitive restructuring helps you to identify these thoughts, understand that they are irrational, and slowly help you to rethink or reframe your thoughts about a specific situation, i.e. dogs. It is important to go into cognitive restructuring with an open and willing mind. You need to accept the fact that your fear is probably not based on rational thought, and as such means that you can train yourself to think differently. If you go into this type of treatment pessimistically, or with the belief that you're being completely reasonable in your fears, you will make the process much harder to overcome. Number 3. Exposure therapy. This step itself consists of several steps. 1. Develop an exposure plan. The reason you learned relaxation techniques was to keep yourself calm while slowly building up your exposure to dogs. Before you start allowing dogs to be in your presence, You need to develop a plan. This plan should include each step you're going to go through between now, no dogs, and actually being in their presence. Your plan should be customized for your particular type of fears and the fearful situations you personally experience. The list should be written in order of least fearful to most fearful, so you work your way up to conquering your most fearful situation. An example of a plan to overcome your fear of dogs is as follows. Draw a dog on a piece of paper. Read about dogs. Look at photos of dogs. Look at videos of dogs. Look at dogs through a closed window. Look at dogs through a partially opened window. Look at dogs through an open window. Look at dogs through a doorway. Look at dogs from outside the doorway. Look at a dog who is on a leash in the next room. Look at a dog who is on a leash in the same room. Sit beside a dog. Pet a dog. 2. Create and practice using an anxiety distress scale. Create and practice using an anxiety distress scale. Use the scale to measure your level of anxiety, with 0 being totally relaxed and 100 being the most fear, anxiety, discomfort you have ever experienced. This is a helpful tool for measuring how your distress levels change over time. The anxiety distress scale can also help you decide when it's time for you to move to the next step of your exposure plan. Be patient and take your time. Don't move to the next step too quickly. 3. Engage the help of a trusted friend with a dog. At some point in your plan, you will have to place yourself in the presence of an actual dog. You need this dog to be handled by a competent and trustworthy person, and the dog needs to be predictable and well-trained. Talk to the dog's owner in advance of executing your plan and explain to them what you're trying to accomplish. They should be patient and understanding, as they may need to simply sit there with their dog for a while as you acclimatize to the dog's presence. It is not a good idea to use a puppy, even if you think they're cuter and not as violent. Puppies are not well trained and can be quite unpredictable. This can cause them to do something unexpected in your presence, which may only exacerbate your fear. Eventually, if you're able to, have your friend teach you basic commands for the dog so you can control the dog yourself. Being in control of the dog may further help you to alleviate your fears once you realize you have the ability to direct their actions. 4. Start facing your fear of dogs. Start with the first item on your plan and carry it out. Repeatedly carry it out until you feel less anxious and fearful doing it. If the step you're doing allows you to stay in one place, i.e. watch dogs through a window, slowly expand the length of time you perform the activity as well. Use the relaxation techniques you practiced to help keep yourself calm. Use your journal to keep track of your progress. Write down each attempt you make and how it went. Rate your level of anxiety and fear before and after each attempt. Remember that your exposure to dogs should be planned, prolonged, and repeated. Don't feel you need to rush. Take your time on each step of your plan until you feel comfortable moving on to the next step. If you start getting anxious, take a deep breath and stay connected to the present moment. Don't get caught up in either the past or the future. 5. Practice regularly. This part of the recovery process is going to be the hardest you'll have to go through. But the only way it's going to be successful is if you keep it up. Make a schedule where you practice on a regular basis. If at all possible, practice daily. Reward yourself for the progress you make. If needed, build rewards into your plan so you have an extra goal to work towards for each step. Number 4. Engaging in mindfulness exercises. Doing yoga, meditating, and performing similar breathing and relaxation exercises can help you deal with anxiety. When you can deal with your anxiety better, it can help you cope with your cynophobia. Some professionals might even suggest hypnotherapy as a way to reframe your thinking about dogs. Number 5. Taking certain prescribed medications. Depending on your specific situation and the source of your cynophobia, your doctor may prescribe various medications. These could be prescriptions to help with panic attacks, depression, or anxiety.